Good morning, and thank you for being here today. You know, 2020 has been a remarkable year in a lot of different ways. Baton Rouge General started the year announcing its partnership with the Mayo Clinic Care Network, and we thought that that was going to be as exciting as a year would get. Then in March, we treated the first confirmed COVID patient in Baton Rouge at our Bluebonnet Hospital, the first of nearly 700 COVID patients who we would care for in the following weeks. In collaboration with the mayor and other hospitals, we opened Baton Rouge's first community testing site right here at Mid-City. And later that month, under Governor Edwards' direction and support, we reopened the acute care units on this campus in only a week, acting as a surge hospital for the region. Just last week, we sent off the doctors, nurses, and medics from the U.S. Navy who supplemented our staffing during the crisis. And now today, we have another big milestone to share with the citizens of the greater Baton Rouge area. I'm proud to announce that Monday, we will reopen the emergency room here at Mid-City. You know, for those who live and work in Mid-City, downtown, and North Baton Rouge, and West Baton Rouge, this means that starting Monday at 7 a.m., they have another nearby option for emergency care. The last few months have been a challenge for Baton Rouge, the state of Louisiana, and the nation. But these challenges are also an opportunity to demonstrate that together we can heal, recover, and actually end up in a better place before the challenges confronted us. Since the Mid-City emergency room closed 5 years ago, we looked at sustainable ways to reopen it and explored and implemented many different partnerships and models of care to maintain an ongoing clinical presence here at Mid-City. And all along, we worked hard to keep healthcare services at Mid-City and transform this campus into a hub of post-acute care. We have rehabilitation services here, we have behavioral health services, skilled nursing, hospice care, along with a lot of outpatient activity. We have the Pennington Cancer Center here, outpatient surgery, family medicine, and much, much more. But emergency care is part of our mission, and it's a service that the people of Mid-City, downtown, North Baton Rouge, and West Baton Rouge want and deserve. And emergency care on this campus is essential to the sustainability of inpatient care services, acting as a front door to this hospital. With the support of the state and this community, we will continue to keep our acute care units and the emergency room open so we can be a part in keeping this community healthier and addressing the disparities in care we know exist. Now, I want to introduce Trey Nelson, who has been working out in the community around Mid-City and keeping the pulse of what is going on. Thank you.
Thank you, Edgardo. It's so great to see you all here with what I'm going to assume are smiling faces underneath your mask. And to all my fellow citizens, I want to thank you for your continued hard work and dedication and looking out for your neighbors as we've advanced through these past few months together. I'm so happy to be a part of today's announcements and truly proud of the team who has stepped up and created something that I know is going to have a lasting impact here. My job is all about community outreach, and since I've started here, I've conducted calls with faith leaders, elected officials, business leaders, and many amazing members of our community. One thing that all those groups have had in common is a deep love and appreciation for Mid-City. But this is not new. Mid-City opened in 1950. In over 70 years, as you can imagine, this campus has built a wonderful and rich history. One story that I keep coming back to involves a different mysterious disease that plagued and crippled our nation. And that was polio. Polio reached epidemic proportions in 1952, and right here in Mid-City, iron lung treatment gave patients new hope. Doctors and nurses treated up to 75 patients at one time on a polio unit. I mean, take a second to let that really sink in. When thinking about polio and our current state with COVID-19, it's easy to draw parallels to the level of response that is still underway here in our fight against COVID-19. So from one pandemic to another, Mid-City has always strived to serve the community's most pressing needs when it has needed us the most. And while that has looked different through the years, our focus has always been on keeping healthcare right here in Mid-City. It's because of this thinking that we believe and we know that access to emergency and acute care in Mid-City, convenient to downtown, North Baton Rouge and West Baton Rouge, is one of the solutions to finding ways of closing the gaps and disparities that we are seeing in access to health care. And this is not just around the United States, ladies and gentlemen. This is right here in our home. And that's what we do as healthcare professionals. And it's because we have a deep respect, love, and appreciation for this community that goes down to the core of our bones. So now I'm going to ask Dr. Jones to come up here and elaborate more on what these emergency services are and talk about what it's going to look like when we reopen those doors next week. Thank you.
Thank you, Trey. This is really a big day, guys. Our teams have been working nonstop for the last couple of weeks to make this possible, to get ready to open on Monday. While the new Mid-City Emergency Department is going to occupy the same space that it did over 5 years ago when it closed, there are going to be a few differences in services offered. As you would expect with any emergency department, we will have the capability of triaging, evaluating, and stabilizing any types of emergencies that come in, including chest pain, belly pain, shortness of breath, broken bones, etc. And you'll be able to access this department by either walking in or by EMS, or by ambulance services. Just like freestanding emergency departments, we do not have on-site an operating room and or specialty services. So some of the major trauma patients and patients that are requiring specialty care will be seen here, evaluated, stabilized, and then transferred to an appropriate full-service hospital as needed. But unlike freestanding emergency department, we will have on-site acute care hospital beds, and we are going to focus on adult medicine services here. We have a great team of internal medicine physicians that are based here at our hospital that will take care of you while you're here at Mid-City. We've been talking for the last several weeks about patients that are delaying and putting off accessing medical care because of their fear of exposure to COVID. Similar to Bluebonnet, here at Mid-City we have taken steps in order to help separate patients from COVID and non-COVID suspected patients. We have different processes and pathways that we put into place. Don't be afraid to come in for your medical care. You will be safe here in our emergency departments. So finally, I would like to thank Governor Edwards, GOSEP, the Mayor's Office, HMG Services, and all of the medical staff and clinical staff that have put in all the tireless work to make this open on Monday. Thank you very much.
Thank you, Dr. Jones. I want to acknowledge all the elected officials who have been supportive of Mid-City in the past, now, and in the future. And I'd like to start by asking Mayor Broom to come to the podium and perhaps share with us a few words. Thank you.
Thank you, Edgardo, and good morning, everyone. Indeed, this is a joyous day for this community as we see the fabric of healthcare once again complemented in our community. Undoubtedly, the day that the ER had to close was a sad day for this community. But as I said, today is a happy day. I believe that each and every one of us shares the common goal that our citizens certainly are in good health and that they prosper as their soul prospers. And certainly having this ER open is a complement to access to health care, which each and every one of us has a genuine concern about. The fact that Baton Rouge General played a very integral part in our response to COVID-19 speaks volumes, and we thank you for what you did. And I know that Edgardo will be certainly acknowledging the other elected officials, but I want to reiterate something that we said earlier when we had the military here happening, and that is collaboration is key in offering a response to closing gaps of disparity that exist in our community. I can't do it alone. You can't do it alone. I'm so thankful for the members of the legislature and Governor Edwards who have worked tirelessly to help assist with funding. And so working together, we can certainly make sure that we respond to the needs that exist in our community and close those gaps of disparity that have existed for far too long. Thank you once again, and congratulations.
Thank you, Mayor, and I'd like to ask Representative Denise Marcel to come to the podium and also share a few words of encouragement, wisdom, and I'm sure fire.
Thank you, everyone, for being here. Thank you, Eduardo, and the staff, and everybody who's worked so hard to make this day come into fruition. You know, it's really, really, really exciting for me today. I almost cried when I heard that the ER was opening back up. It was a tough thing to see happen to close the ER here in Mid-City. And I was on the Metro Council at the time, and I remember Ms. Stephanie Anthony, I don't know if she's here today, but Ms. Stephanie Anthony and about 10 other people, she called me and asked me, would I come out and would we protest against it, although we knew that it probably wasn't going to do any good. And I remember us standing across the street, about 15 of us, and we were just hollering, you know, that we needed our hospital, we needed this hospital. And I remember that she started to cry about this hospital closing, and I said, well, you know, we're going to continue to fight. And so today, that fight has continued since the close of this hospital. I want to thank my fellow colleagues, Representative Ted James and Senator Fields that's here, and many others, and Senator Barrow, who could not be here, for fighting at the legislature to make sure that the money, because as I met with them, they said one of the problems that we have, Representative Marcel, is the money does not follow the patient, and the model is going to keep us from opening. So we continued to fight until the governor pushed that bill, and we were able to carry it across. And I'm excited, I'm ecstatic, because this is my fabric, this is my neighborhood. I love Baton Rouge General Mid-City, and I no longer have to go across town. Thank you. God bless you.
Thank you so much. I also want to acknowledge Tate James and Cleo Field. Ted was a patient at our hospital, and I'm so happy to see him here. I asked him, did we treat you well? He was so excited to be alive, literally. And thank you so much. Thank you so much for coming. I know you were scared of coming in, but we're all wearing masks, and you're going to be okay. Thank you so much. So we're now going to open it for questions that you might have, and I have a team of people that can help me if I can't answer a question. So members of the press, it's your show now. Yes?
What was the process like to prepare for Monday, or if that's still happening, with the treatment of COVID patients at the same time?
I'm gonna ask Dr. Jones to perhaps come in and answer that question. It's clinical. If I answer it, I'm gonna butcher it. So there you go.
So as you know, the crisis isn't over, and we still have some COVID patients that we're treating. But as we alluded to earlier, we've learned a lot about this disease and what we need to do in order to protect people. So we have been spending a lot of time developing the processes and pathways to help to keep people safe. So that's been one of the things we had to learn. Okay.
Other questions? All right, you're stumped. I'm sure that after the event is over, if you want to talk to any one of us individually, we'll be available. Also now, if you have not been to the ER in a while and want to visit it, we're going to have tours. I don't know if we're going to go inside or outside, probably through the inside, and we can tour. Thank you so much for being here this morning, and thank you for supporting Mid-City. Thank you.